So does shockwave treatment really work, or is it shockingly disappointing? I'm Dr. John Tait. I'm a non-surgical orthopedic doc, regenerative medicine specialist, and that's what we're going to be talking about today in this video, because this device is a shockwave treatment unit. And I use this very commonly in my practice. It's a very synergistic treatment for the right thing, but you got to know the right thing and use this at the right time for it to be successful, or it may be a total waste of your time to even pursue this kind of treatment. So let's talk about the history of these devices. So this technology was really borrowed from the technology called lithotripsy, which back in the day they used to bust up kidney stones. So in the olden days, they would have to cut somebody open to go explore their kidney, extract kidney stones. Then they started to figure out we could pulse an external wave at the body, conduct that wave of energy through the body to hit the target, which in that case was the kidney, to break up these calcified stones, by which they would pulverize them down to a smaller size, and then the person could pee these things out instead of having a big surgery. So it's quite the development and quite the, I guess, revolutionary change or evolutionary change in that treatment, from going from a very invasive procedure to one that's less invasive and way more comfortable. So then if we take this over to orthopedics and we look at, well, where did this really catch fire back in the, say, 1980s, 90s, because that's how long ago it was, even though these devices are now having a resurgence. It was the 80s or 90s. And there was a very interesting study done at the time, and they were looking at a heel spur. So on the bottom of one's foot, you can develop a spur, and they thought these spurs were overly painful because they would take their thumb and they would put it into the heel of somebody's foot, and they would jump off the clinical table and say, wow, that spur must be painful. Because on an x-ray, you would see this little extension of bone. So in this study, they said, we're going to apply this device because if we can break down calcifications over here with a kidney stone, maybe we can break down this calcification that's growing off the heel bone, the calcaneus, and that spur could go away without, similar to the kidney issue, having to do an invasive procedure to go cut down to that bone, shave that bone down. Okay, so they started this experiment, they applied the treatment to a bunch of patients, and they tracked the results. And lo and behold, the experiment failed. It was not able to reduce the size of the bone spur. So they said, hey, this doesn't really work. It didn't take care of the bone spur. Still going to have to do surgery on these patients. But then they started, of course, interviewing the patients that have had these treatments in the experiment. And they said, well, how's your foot feel? Is the pain any better? And by and large, most of those patients had pain reduction, which is what I'm after in my practice. So the experiment they had to reduce the bone spur actually failed, but it didn't fail in reducing the patient's pain. So now we took that concept forward, or people at the time said, how can we apply this to other injuries, not just a heel spur problem, but how about a tendon problem at the elbow, like a tennis elbow or a golfer's elbow? How about a tendinopathy in the knee or the Achilles? Or the plantar fascia, because back to that heel issue, what we understood is that the plantar fascia was pulling on that bone, that calcaneus bone, and really forming that spur. You're literally tearing apart the periosteum, and that periosteum was getting stretched and torn. So again, the shell of the bone. So they were able to use this in different applications of what we call tendinopathies. They saw that these results were very good, and not always consistent, of course, and not universally effective, but compared to the other things like surgery or injecting cortisone, they were very safe interventions. So now, fast forward this to current day, there's all kinds of different devices on the market, and we got to understand a little bit of what makes the device go, what are the different types of devices, and we'll talk about that a little bit today. But first I want to get into the physics, the science of this, and how does this device work. Inside of this, we have an element, a projectile, that through air here is propelled forward and hits the end of this transducer. And this, held against the body, will then transduce or conduct that energy into the tissue that we're aiming it at. So if I'm treating an elbow issue here and I have this device sitting on top of that, it's going to pulse that tissue and put the energy through the tissue. And with that energy going into the tissue, something we call mechanotransduction, we induce a biological response. And there's several biological responses that happen here. First, we can manipulate the nervous system. So the nerves in these tissues that are sensitized we can actually see a pain reduction over time by overstimulating the nerves in a way so that we reduce the pain in that environment and dissipate pain in that environment. So it's kind of akin to PRP in my practice, where we're inducing almost an irritant inflammatory response to induce the body's own healing mechanisms that releases growth factors and enkephalins, endorphins, and other things like that. And it stimulates a natural pain reduction response. Now, in the moment of doing it, it's kind of like a deep tissue massage, where it's not always comfortable to get on some of these trigger points and work on it. But it's one of the mechanisms as to how this is treated. So mechanotransduction is a key element. We get that cellular response, we get a reduction in inflammatory response, and then if we cycle more treatments, because this is dose dependent, you have to do more treatment to get the effect. When we start cycling treatment once or twice a week over a longer duration of time, what they start to see in the tissue when we analyze the effect of this is that you get angiogenesis. Angiogenesis is how we grow and develop new blood vessels, small capillaries, at the very microscopic level that's able to feed the injured tissue more blood. And then obviously the nutrients we're carrying in our blood can go to that target site and help it heal. So we can get new blood cell, or really new blood capillary development, which brings more blood cells and growth factors and nutrition into the area to help it heal. So angiogenesis is part 2 of that. And then collagen synthesis. So you think about this kind of in a fashion similar to a workout, right? Where I'm lifting a weight to exercise a muscle, and I'm kind of inducing an injury to stimulate the body's response to get stronger. So I'm tearing down some element of microscopic muscle fiber to help it induce a change. So similarly, when we're targeting this at tissue of, say, a tendon attachment, in that tendon is a structure called collagen. And collagen are like the little threads that make the tendon. And those are the threads that break, and those are the threads, when we break enough of them, that we have a more substantial tear or injury. So with that, induction or transduction of this mechanical force into that tissue, we can stimulate collagen production and activity, by which that tendon structure that we're aiming this at, soft tissue, obviously a lot of the time using this for that, compared to something like a deeper cartilage defect in the knee, we can stimulate that collagen. And then I also mentioned previously the pain reduction, because we get this nerve desensitization. It's like if you're stimulating stuff enough, it's like when you get hurt and it's an acute ache and you rub it really fast, you're changing the nerve conduction back to the brain. So in a similar fashion, as we continue to work on these tissues that are sensitized, both through the release of growth factors, through that new blood capillary development, through collagen stimulation, over time with treatments, we're able to get a healing effect on those tissues. So what I thought I'd do is just turn this device on so people can see and hear, and you can't quite feel this through the screen, but you can see that it's a very safe and very well tolerated treatment to do this. So I'm going to turn it on. It's going to make a little bit of noise, but I'll just silence myself while we do this. But if we put it on the tissue, usually we'd use some conduction gel to help this effect. But you can see that's all there is to it. I mean, it's a very well tolerated treatment for people to use and go through. And if you're the patient that's also fearful of needles, this can be something that's very effective for us to treat soft tissue injuries. So a lot of ligament, tendon, muscular injuries. Is very good on trigger points. So think about this as a deep tissue massage. And when we look at this comparatively, we're talking about the pressure and the amount of energy put into this. It's like 14,000 pounds per square inch, okay, is what we can induce through this thing. So that would be a very intense massage with this very short pulse rate. You could hear that clicking rate. So it's very kind of high amplitude and short duration. So we're just pulsing this tissue over and over. It's not like somebody's leaning into you, with their thumb with 1,000 pounds of weight. But compared to working on this, say with massage or other techniques like Graston, where we're working the tissue, and these are all great techniques, getting a massage, using Graston techniques. A lot of these things are used in therapeutic settings, but this gives us a tool to induce a lot more change much faster in a very localized area to penetrate that tissue and stimulate through that mechanotransduction. So again, this mechanical energy that induces this biologic change, we can change what's going on at the tissue level, at the root cause. So versus something that's just purely a pain reduction mechanism like a steroid shot, or as you know from other content I've created, we don't want to put steroid into these tendon injuries because that can actually weaken the tendon. We want to do treatment that can strengthen the tendon, help it heal at the root cause so that people can get over to the rehabilitation side working with a good trainer, physical therapist, and build up the movement patterns, the strength, the endurance they need to go back to the activities they love doing. So I thought I would do the kind of the 101 level on Shockwave today because this is getting a lot of buzz out in the musculoskeletal orthopedic world, especially when it comes to non-surgical treatments. So that's how this device can be beneficial. If you're out there with soft tissue injuries, if you're looking for another edge, something that can accelerate healing without a needle, then Shockwave could be a good fit for you. So if you like this content, as always, like it, share it, subscribe if you want to see when we post up new content. And if I can help you in any way, check out the comments below. There's a link to my practice where you can connect with us. We can see what's going on with you. And if there's something that matches what we do in my practice to help you non-surgically, that's what we're here for.